Group of muscles we will describe are located on the face and neck and are responsible for various facial expressions. One of these, the orbicularis oculi, encircles the orbit and eyelid and acts as the sphincter muscle of the eyelid. Forceful contraction of the entire muscle produces the action of winking. Another sphincter muscle located on the face is the orbicularis oris. Its fibers surround the mouth and blend with other muscles in the area. When the orbicularis oris contracts, it closes the lips and protrudes them, and because of these actions is sometimes referred to as the kissing muscle. The orbicularis oris also plays important roles in articulation and mastication. The muscle which produces the facial expressions of smiling and laughing is the zygomaticus major. Its origin is the zygomatic bone, and its fibers insert into the skin and blend with other muscles near the angle of the mouth. When it contracts, the zygomaticus major draws the corners of the mouth upward and outward. Located in the subcutaneous tissue of the neck is the platysma muscle, which arises from the fascia covering the pectoralis major and deltoid muscles. Some of the fibers of this broad, thin muscular sheet join with others at the opposite side, but the majority insert on the mandible and the skin, subcutaneous tissues, and muscles near the angle of the mouth and lower face. Its contraction produces the facial expressions of horror and fright, and it also tightens the skin of the neck. Lying underneath the platysma, in the region of the neck, is the sternocleidomastoid mastoid. Its two heads of origin arise from the sternum and the medial one-third of the clavicle, and it inserts into the mastoid process of the temporal bone. When the muscle contracts, it pulls the head down towards the shoulder on that side, causing the chin to rotate upward toward the opposite side. When muscles on both sides of the neck contract together, the neck is flexed, resulting in forward movement of the head. The most superficial flat muscle of the abdominal wall is the external oblique. It arises from the lower 8 ribs, and its fibers travel in an oblique direction, downward and forward, to insert on the iliac crest inferiorly, and to insert anteriorly by its aponeurosis into the linea alba. The external oblique works with the other abdominal muscles to compress the abdominal viscera. Other actions include rotation and lateral flexion of the trunk. Enclosed within a sheath formed from the aponeuroses of the anterior abdominal musculature is the rectus abdominis. It is a long vertical muscle lying on either side of the linea alba, which arises on the pubic crest and pubic symphysis inferiorly and inserts on the xiphoid process and the cartilages of the 5th, 6th, and 7th ribs superiorly. 3 fibrous bands, called tendinous intersections, cross the muscle and attach the rectus firmly to the anterior surface of the sheath. In addition to compressing abdominal viscera, the rectus abdominis flexes the trunk and is one of the major muscles acting when doing sit-ups. Located on the anterolateral chest wall is the serratus anterior. It arises from the upper 8 to 9 ribs, and its fibers can be seen interdigitating with the upper fibers of the external oblique muscle. It inserts on the cervical border of the scapula, from the superior to the inferior angle. The serratus anterior holds the scapula against the chest wall and protracts and rotates the scapula upward. These actions are very important in reaching and pushing movements. This muscle is sometimes referred to as the boxer's muscle. Another muscle that acts on the scapula is the trapezius, which is located on the back. It is a large triangular muscle which originates on the superior nuchal line and protuberance of the occipital bone, the ligamentum nuchae of the neck, and the vertebral spines of the 7th cervical and all thoracic vertebrae. Its insertion is the spine of the scapula, the acromion process, and the lateral one-third of the clavicle. Some of the actions that the trapezius performs include elevation, retraction, depression, and upward rotation of the scapula, and it can also assist in extension of the head. Three of the muscles which have insertions and therefore actions on the humerus will now be demonstrated. The superficial triangular muscle, which covers the lower part of the thorax and lumbar regions, is the latissimus dorsi. Part of it arises from the lower sixth thoracic vertebral spine and lies anterior to the trapezius. Some of the muscle also arises from the lumbar and sacral vertebrae through the thoracolumbar fascia, from the iliac crest, and from the lower 3 or 4 ribs. It wraps around the body between the ribs and the humerus and inserts by its tendon into the intertubercular groove of the humerus. The orientation of the fibers allow it to pull the arm back in extension and also to adduct and medially rotate the arm.